Chaplains from the Army Reserve Medical Command are learning to identify symptoms of post-traumatic stress disorder to better serve their comrades in arms. According to studies concluded in January 2008 by the RAND Corporation, approximately 19% of soldiers returning from combat deployments were suffering from stress, anxiety, or depression. In April, the Reverend Chris Parker taught a specialized course to the Army Reserve chaplains to help understand and recognize PTSD symptoms among today's soldiers. Parker is the director of the Burn Recovery and Research Foundation in San Antonio, Texas, and specializes in the psychosocial treatment of trauma.
There are psychological symptoms of PTSD that have been well known for many years. And there are, in addition, behavioral symptoms and physical symptoms. Behavioral symptoms and physical symptoms are something that I've been particularly focusing on because they've not been as well documented.
Many of the chaplains in attendance had extensive experience caring for soldiers suffering from PTSD.
Dr. Parker's presentation today helps tie together a lot of different approaches to practical care for the traumatized patient or veteran.
This provided the scientific, the technical background to it, which was very helpful filling in the gaps.
It is the seat of all our rational.
Reverend Parker and other trauma specialists will be conducting further combat stress and PTSD training throughout the year at various installations across the United States.
I think the more that we get in touch with what our soldiers are going through, what our soldiers' families are going through, the more we're able to help them, whether in the medical profession or whether we're chaplains or whether we're caring fellow soldiers.
Reporting from Clearwater, Florida, for the Army Reserve Medical Command, I'm Army First Lieutenant Michael Meyer.
As well as expertise, we've already talked about some of these points. Number one,